Everybody to this meeting of the Health and Wellbeing Board, which is being webcast via Zoom, and I hope that everybody has their microphone working and are ready to participate. If you would like to speak, please raise your virtual hand to indicate that you wish to do so, and I'll take comments and observations in the order that the hands are made. Some of the items on the agenda are likely to be discursive rather than just papers, and raising your hand will ensure that I can make sure everybody has the opportunity to speak. After our welcome and apologies, we are going to have a minute's silence, which I will talk about in a moment. And please, could you keep your video on throughout that silence? So I'm not going to introduce everybody, but I would ask that people do introduce themselves when they speak. And for those that are watching remotely, you should have everybody's name on the screen, which shows their face. So first of all, Michelle, have we any apologies?
Yes, we have. We have apologies from Alison Simmons, her substitute David Harborne. We have apologies from Lisa Winwood, her substitute is Mr. Phil Kane. Apologies from Naomi Lonergan with no substitute, and apologies from Councillor Baker, no substitute.
Thank you very much for that. Right, can I now just talk briefly about what's happened in the last few months? We haven't been able to meet because we in particular have been so involved in what's going on during the pandemic. I think everybody around the group today has been right on the front line and right in the middle of what's been happening and trying to interpret what's going on and to do their best to ameliorate, if you like, the effects of COVID-19. But despite our very best efforts, we have had a number of deaths, and we have had some people who've really worked almost to the limit of their capacity. And that's been very, very hard for everyone. So I would like to hold a minute's silence in memory of those who have died, not only the health workers and the care workers, but their families as well. And also everybody else who's been involved in the hospitals, in the care homes, everywhere. It's affected everybody's life. And also to remember the exceedingly hard work of all those who have been involved. So would you like to just think about that for a moment and thank, in your own mind, all those who've worked so hard and those who have lost somebody. Thank you, everyone. We know that there will be more hard work and regrettably more deaths to come, but we hope that the work we do today and the work we go on to do will help to make sure that those are minimized as much as they possibly can be. So we start with the minutes of the last meeting and the declarations of interest. So can I first have anybody's declarations of interest, should they not already be declared? No, none. Thank you very much. And the minutes of the last meeting, I don't know if there's anything that anybody wants to raise at this point. No, thank you very much. So we haven't any public participation. So now we go over to Sharon for the Outbreak Management Advisory Board and the Outbreak Control Plan. Sharon Stoltz, Director of Public Health.
Thank you, Chair. Apologies to those people on the call who will be very involved with this and will have heard what I have to say before, I'm sure. But I'm going to go through this in a little bit of detail so that anyone watching the meeting can be informed of the work that we're doing at the moment. So all local authorities with responsibilities for public health were required to develop and publish COVID-19 outbreak control plans by the 30th of June to ensure the local delivery of the NHS Test and Trace programme for COVID. But also set out how we are going to deliver across the system an effective local outbreak response. We didn't have very long to develop these plans. So I'm conscious that whereas normally we might do quite wide consultation when developing these plans, because of the short period we had this time, we were able to do some consultation on the draft document. The document as published on the Council's website is intended to be a flexible document. We had to publish our plan by the 30th of June, as I've said, but it's intended to be what we call an iterative or living document. So as we do learn more about the virus, as we develop our local response, there will be an opportunity to review and update that plan. And indeed, it has a review date for March next year. So we have made a commitment to review our plans before that date. So the outbreak control plan, based on national guidance, sets out a response based on 7 themes. First of those themes is around care homes and educational settings, including early years and schools. The second area is high-risk places, locations and communities. And in York, we've agreed to include our colleges and universities in that second theme there. And I'll say a little bit more about universities in a moment. The third theme is our local testing capacity. So ensuring that we have good linkages across the system to the NHS Test and Trace programme, and that our residents locally have good and easy access to a test for COVID if they have symptoms. Fourth area then is around our contact tracing in complex settings and ensuring that we're able to respond quickly to contain any local outbreaks. The fifth is around data integration. So members of the board and anyone listening may well have read in the national media some of the difficulties there were early on in the pandemic in terms of sharing data. And certainly as Director of Public Health for York, I was raising concerns locally around some of the data that we had access to. that data has improved, but it's still coming down through a number of different sources. And so it's very important that locally we have a robust system in place to understand the different information we now have access to across the system, and that we're developing a way of not only analysing the national data that we receive locally, but also that we have local intelligence gathering as well, so that we have an early indication of any rise in cases. And so that's a very important fifth work stream for us. The sixth area then is around supporting vulnerable people to be able to self-isolate. We understand very well from the work that we've done from the start of the pandemic to now, that there are a number of people who will need help if they are asked to self-isolate in their homes to prevent the spread of infection. That help might be social support if they live alone. It might be just having somebody to check in on them and to have a friendly phone call so that those people still feel connected and they're not becoming socially isolated. It may be help to get food or medicines, whatever that help may be. It's important that we have systems locally to be able to provide that support. And then the final area is around our local boards and governance structures. So I'm going to say a little bit about the Outbreak Management Advisory Board, and then how I feel that board needs to link with the Health and Wellbeing Board, and what I feel to be the role of the Health and Wellbeing Board going forward, so that we can then have a discussion about that as a group. So the Outbreak Management Advisory Board, there is a requirement for local authorities to set up an outbreak board. This has a different remit to what in public health and in the NHS we traditionally think of as an outbreak control board. The Outbreak Management Board for COVID is really intended to be a system-wide group that looks at our citywide response across all of those 7 themes. And it has three key responsibilities, really. One is to have oversight of the pandemic response across the city, and oversight of the outbreak control plan and how that's delivered, monitoring data and understanding the local picture of what is happening with the pandemic locally. It also has a responsibility to ensure that all the right partners are involved in those discussions. And so our Outbreak Management Board, which is chaired by the leader of the council, has representation on it from the NHS, from the council, business leaders represented by the local economic partnership, and also travel. So we have York First represented on that, as well as Health Watch and the voluntary sector through York CVS. So the group has a core membership, but has agreed that we will, I should say the Police and Crime Commissioner and North Yorkshire Police are members of that board as well. The board also has the option to co-opt other partners for particular agenda items or discussions. And then the third area, key area of responsibility, is to ensure that residents particularly, but also people working in the city, have access to good information. So communication and engagement is another key theme. If I can come on then to say a little bit more about colleges and universities. So in national guidance, colleges and universities are grouped together within the that first work stream around education settings. We felt that in York, because students make up such a large proportion of our population, students represent around 20% of the population in York. And if we look at our universities and colleges, that's around 40,000 students in the city. And we felt that that was such a significant issue for us that we wanted to have a particular focus on colleges and universities and include them in that second work stream and treat them as complex settings. And so to that effect, we have established a subgroup of the Outbreak Management Advisory Board that brings multi-agency partners together, but particularly has representation from the universities and colleges, so that we're able to ensure that we have a system-wide response that takes account of the particular needs of students and the particularly complex settings around our universities and colleges, so that we can be sure that we're providing that wraparound support to not only the staff employed in universities, but obviously students as well. I'm going to say then something, Chair, about the new guidance that was issued last week around local authority responsibilities around localised lockdowns. Yeah. There's been a lot about this in the press at the moment, and we know that some areas, particularly Leicester, that was the first city and county to experience a local lockdown, and say something about that. So one of the asks that local authorities and local resilience forums have made of the government is to clarify what we mean by a local lockdown and what responsibilities we have locally around that, and what might the tests be to indicate that a local lockdown is required. And so the guidance now says that the local authority, who has the responsibility for calling a lockdown, in consultation obviously with other partners, needs to be satisfied that 3 conditions are met. The first of those is that there is a serious and imminent threat to public health to residents and public health in the local area. And so obviously COVID is a threat. We regard it as a threat now, but it's being managed. But if we could see that we had a rapid increase in the number of cases, we had evidence that the NHS particularly was under a great deal of stress or threat in terms of being able to respond to those COVID cases, then that's what we would consider to be a serious and imminent threat to public health, if we could see that our services were in danger of being overwhelmed. The second is that a direction is necessary to prevent, protect against, control, or provide a public health response to the incidence or spread of infection. And what we mean by that is that the existing local control measures are no longer sufficient to prevent the spread of the virus, and that therefore we have to consider a lockdown in order to be able to contain that spread of infection sufficiently and halt the spread of that infection. And then the final one is that the prohibitions, requirements or restrictions imposed by the direction are a proportionate means. So that means that the local authority, in consultation with partners, and in particular police, who would need to be involved in policing that lockdown, are satisfied that we've exhausted all other measures and that we have evidence to suggest that those measures are not sufficient, and therefore a lockdown is a proportionate response. In making any lockdown, a local authority and the police, together with the police and other partners, have to agree how long we think that lockdown needs to be in place for, and there needs to be a review at least every 7 days as to whether that lockdown is still required. And then prior to issuing a direction, local authorities also have to have due regard of their public sector equality duty as set out in the Equality Act 2010, and they need to carry out an equalities risk assessment to determine whether any lockdown measures may have a disproportionate effect on any particular sections or groups of people in the community. So my ask, therefore, of ourselves as the Health and Wellbeing Board, so each and every one of us on the call this morning, is first of all, to consider our system-wide response to COVID and the board's responsibility in receiving assurance around those outbreak control plans, how the board ensures that all the partners and the public that as agencies we represent are sufficiently informed and involved in our outbreak control planning. So we all have a responsibility for that as representatives of our various organisations. And then thinking about those lockdown measures and those 3 tests, what role do we think the Health and Wellbeing Board has in working alongside and advising the Outbreak Management Advisory Board, which would be the place in which that decision would be made around whether a lockdown would need to be introduced. So I'll probably stop there, Chair, and ask people's views on those key questions.
Thank you, Sharon. I think particularly the latest update on how we locked down was something we've been waiting for some time. And obviously it's got to be evidence-based and considered very carefully. So I'd like to have any questions or comments to Sharon, if anybody would like to raise their virtual hand. And if not, I'm going to ask Sian to start us off, because Sian's very good at starting us off, and then I'll take Anna. Sian, are you there?
Yes, sorry, I was just trying to unmute myself. Despite the fact we do these calls all the time, I still can never find the button. I have to apologise to everyone for technical incompetence. I think one of the things that struck me in reading through the plan was that although this is very much about outbreak management, it's about preventing the spread of the virus.
Yes.
There is a lot about the support that people need in order to make that happen, in order to be able to comply with any outbreak control methods. And I do think the conversations we're starting to have now with the general public about what's going on are unsure about what they should be doing now. I think when the outbreak first came, the messages from government particularly were very clear, and as the control measures have changed, I think the messaging feels less clear. So I think that there is, I think what Sharon was sort of talking about in terms of us sharing information, I think it's really important that we have clear messages about what we want people to do. I know even just myself walking around at the moment, I feel like I am very much, this will surprise people, I am a rule follower. And actually, I'm finding it really hard to know when I'm following the rules at the moment. and when other people are or are not following the rules. And I think this paper does sort of talk about some of the public attitudinal stuff that's happening at the moment about we all believe nobody else is going to do it, but we think we're doing it. I think we need to make it as simple as possible for people to know they are doing the right things. And I think I'm very keen to play a part in how we make that happen. I do have to apologise. I haven't made any of the meetings so far because they are evening meetings, and like many other working parents at the moment, I am struggling with keeping my work and personal life balance in check. But I think, you know, there are lots of people out there who are in similar situations trying to do the same sorts of things. So it's a bit of a reality check for me in terms of my willingness and my ability to do my job properly at the moment.
Thank you. Thank you very much, Sian. And thank you for your comments, because I think the comms are absolutely key to this. And I think part of the problem we found in the council is that the messages change very quickly, and we've just got to keep up with them. I think that's a big issue, and I'm sure Sharon will want to comment on that in a moment. But I'm going to take Anna next, Councillor Anna Perrott.
Thank you, Chair. So Sian covered one of the things that I want to really ask about, but I suppose just taking it a step further, how involved are we going to sort of get partners with coming up with communication strategies? Because I think it's a really great opportunity for us to sort of amplify the messages that everyone is putting out as we can appropriately. But I also wanted to ask a little bit more about on page 18, just the sort of financial aspects of our public health response, because obviously the money split over 2020 and 2021 and then 2021, 2022. And it looks like we're sort of end loading it so that more money is being spent in the second year. I just wondered if you could give me a little bit more background about the rationale for dividing the money in that way, please.
Thank you, Anna. Sharon, can I ask you to comment on those two, please?
Yes, so if I take the money one first,
Yeah.
there's uncertainty at the moment as to whether the COVID grant that local authorities were given, so for York that was just over 173,000, is for 1 year, or whether we will get any further grant monies. And so because of that uncertainty, what we've done when we were thinking about how we needed to allocate that money was to assume the worst, that was a one-off grant that we were going to get, and therefore what were the priorities for that money if we had to make it last for 18 months, which is, you know, what we're planning for at the moment in terms of needing a pandemic response. And the split was purely because we're already partway through 2021, so you don't need a full 12 months of spend for this year. So all we've done is taken a proportionate amount for the remainder of this year, and then assumed that we would need those costs for all of next year. So that's just why the money looks different for this year than next year. At the moment, the budget is sitting in a ring-fenced budget called COVID-19 within the council. We have and the detailed planning of how we're going to spend that, it will be in response to our risk assessments and issues that may crop up as the pandemic develops. So I have, as Director of Public Health, I hold that budget. I'm going to be very prudent in how we spend it, so that we don't spend it early and then find that we need more money for further down the line. So that just explains the difference between this year and next year in terms of spend. In terms of communications and engagement, I absolutely agree with what Sian has said, and I'm sure everyone on the call would agree with that as well. Communications is a standing item on the Outbreak Management Advisory Board, and we've had 2 meetings so far. At the first meeting, Claire Fole, the head of comms in the council, outlined the communication strategy. And at the last meeting, Claire did a joint presentation with York BID, the Business Improvement District, around some of the work that's been done with businesses in terms of opening shops, etc., in the city safely. Alison Semence made the point at the last meeting about this is not just about communications, it's about engagement. And I think my view on that is that we all have a responsibility to contribute to that. And I absolutely take Sian's point about how in public health we can give partners the right information and tools to be able to do that engagement. And I'm happy to have a conversation offline with Sian and York CVS particularly, around how we might do that. But obviously keen to have feedback from any other partners around the table in terms of what more can public health do to support their organisations in having kind of bite-sized pieces of information that can be shared with their staff, so that, you know, we can start to embed those key messages into every contact that we have with the public, wherever that may be. So I'm certainly happy to make that commitment from public health, but we'll need help from people to be able to do that really, really well.
Yes, thank you, Sharon. At the end of this item, I'm going to ask for everybody to commit to this plan, and in that will come the communication strategy, so that we are all giving the right messages to the right people in the right language at the right time. So I'll just warn you of that. But I would like to take a few more comments. I wonder if anybody else would like to contribute. If not, oh, David Harborne. Yep, right, I've got various hands.
Yes,
David Harborne first, and then Andrew Lee, and then Mike.
Thank you very much, Chair. And just to introduce myself, David Harborne, I chair York CVS, and I'm standing in because Alison Semence is on holiday this week. I very much appreciate the papers that have been presented today, and of course, like everybody else in this meeting, I praise the rapid response that there has been across the city of York, and the engagement of all the services, statutory and otherwise, in helping us to get to where we are today. I think it's been phenomenal at every level. Of course, like every other part of the country, I'm sure we will look back and see ways in which we might have done things differently, and therefore might do things differently in the future as well. That's a general remark, which then leads on to a point about the kind of ripples on the pond. Quite rightly, the plan that we're looking at the moment is focusing on the heart of the problem, which is the management of COVID-19 itself and what happens when there is an outbreak. And then you start to ripple outwards to cover many of the points that are actually towards the end of this plan regarding vulnerable people. Yeah. And I just wanted to make a point, which actually I could have raised here, or indeed under the next item when we hear from Peter Roderick, that of course we did respond very quickly to setting up ways of helping people who might be isolated, especially those who are deliberately shielding during an outbreak. York CVS itself had the phone line which linked in with GP surgeries across York that allowed people to seek immediate access to non-medical support, and within the first week we supported 200 people. Over time it's approaching 1,000 now through that route, and we are by no means alone in providing that. I know that Age UK changed its priorities almost overnight to supporting people through the befriending service, shopping weekly for people, and of course continuing with their work in the field of home from hospital. What we've learned through this process is in some senses not surprising, that of course there are different needs according to different parts of the community. So there are adults with learning difficulties, there are people living with dementia, all of whom require something of a tailored service and tailored support. And in many cases, it is voluntary organisations who are already providing that, who are best placed to provide it. But what we also found was that many volunteers, and here's a sweeping generalization, but nevertheless it's grounded in truth, a lot of volunteers tend to be towards the older end of the spectrum, and some of those themselves had to cease volunteering because of shielding.
Yes, they did.
At the same time, it was overnight, certain services that were being offered had to be withdrawn, which do connect with well-being. And some points might appear on the face of it even trivial, but actually really make a difference to people's lives. If you cannot cut your own toenails and you rely on a volunteer to do it, and that volunteer is no longer able to go to your home because of lockdown, how long do you go with toenails that are just growing and growing? It's not actually a trivial point. And then you get into all the wider issues of the impact of this on mental health, which we will come on to later in the meeting. I know that, so I'm not going to labour the point now. I think the point I'm trying to make is that we learned such a lot about the way in which the whole of the city pulls together in these first few months, that in the event that there is a second localized lockdown, and looking beyond that, other pandemics in the future, we need to know where our strengths lie, how we protect those individual services, many of which are completely under the radar, like toenail cutting, to make sure that we are really respecting the health, not just in terms of COVID as it is now, but the mental health, the wider dementia issues, and then the well-being of the individuals. And we really capture the spirit of voluntary action that I think came to the fore very much during this first period of lockdown. So it's underlining the importance of that part of the plan, which is to do with vulnerable adults. And that's what I wanted to say this morning. Thank you, Chair.
Thank you, David. I'll ask Sharon to comment after we've had Dr. Andrew Lee and Mike Padgham. So Dr. Andrew Lee from the CCG, would you like to comment?
Thank you, Chair. Firstly, I'd like to congratulate Sharon and her team on their hard work at producing this outbreak plan. It's been a lot of effort, I'm sure. And also thanks to the voluntary services and across to David, who have worked pretty hard with our primary care colleagues to ensure we protect and support some of the most vulnerable in our communities. One reflection, the city of York has actually got off fairly lightly in terms of infections from COVID, especially when you compare ourselves against some of the neighbouring local authorities in Yorkshire and the Humber. And we must be careful that we are not complacent going into the winter. Many of you might be familiar with the Academy of Medical Sciences report, which forecasts we could have a difficult winter, flu and COVID combined. With that in mind, if we are thinking of lockdown or the need for local lockdown and for outbreak measures, speed is key. Timeliness of action is key. I was a little concerned, Sharon, that there are lots of protections built into place. And what I'm concerned about is if Sharon is in a difficult situation of having to make that decision to advise local lockdown, that we do not, as a Health and Wellbeing Board, leave her unsupported. It's a very lonely place to be, to have to make that call. And I would like us as a Health and Wellbeing Board to be clear about our priorities if we get to that stage. For the CCG during the COVID period, we had 3 simple priorities, call it a mission statement. It was to save lives, protect the vulnerable, and keep services going. And I would recommend that we are clear, likewise as a Health and Wellbeing Board, what our guiding priorities are. Thank you.
Thank you very much. And Mike Padgham, please.
Thank you, Chair. Just for those who don't know me, I'm Mike Padgham, Chair of the Independent Care Group, which represents independent sector providers in care homes, home care, extra care in the independent sector. A couple of points. Yeah, we very much support the outbreak control plan, but I'm wondering whether it might be helpful to have our input on the actual membership of the board, because I think we're involved in other areas, but I don't think, correct if I'm wrong, that we've got any linkage in with York, particularly as care homes is one of the 7 key themes. I wonder if people think our input would be of some assistance.
Thank you. Sharon, would you like to take up those 3 comments and questions?
Yes, I very much appreciate Andrew's comments, Dr. Andrew Lee's comments, and that was kind of where I was getting at, really, in terms of what I see as the role of the Health and Wellbeing Board. The guidance around the governance arrangements for COVID suggests that, as well as an outbreak management advisory board, we need a COVID-19 health protection board. I've resisted so far setting up a COVID-19 health protection board, mainly because I know and I'm involved in various meetings and groups that are doing the work that a COVID-19 health protection board might do. But picking up Andrew's point, the intention of the COVID-19 Health Protection Board and the guidance is where the professionals come together to advise the Outbreak Management Advisory Board on those specific health and social care issues. So I'm just wondering, in response to Mike's point about and I'd be interested in other people's views on this, is that if we establish that professional COVID-19 Health Protection Board that sits as underneath the Health and Wellbeing Board and the Outbreak Management Advisory Board, so the group kind of operates with a virtual relationship to this board and the Outbreak Management Board, that brings health and social care professionals together who will be looking at the scientific evidence and the local intelligence and service understanding of what's happening in terms of a pandemic. That, I think, would strengthen our decision making around not just lockdown, but whether we needed to put in place any additional measures to contain the virus. To me, lockdown, if we get to a lockdown situation, we will have failed to a large degree, because it will have meant that we will have not have responded quickly enough and at sufficient scale to be able to contain any emerging issues. And so, picking up Andrew's point and Mike's point together, I feel that if the board is supportive, and I'd be interested in Simon's view from the hospital as well on this, if we can pull together that professional group, then it would, obviously the independent care group would be key in terms of that. I kind of feel that would probably tick a number of boxes for us, but would be interested in others' views.
I'll bring Simon in a moment, but I think the whole idea of this must be evidence-based is really, really important. Simon, would you like to comment?
Sorry, just unmute myself. I mean, starting with just a general comment and sharing Andrew's sentiment, just to thank Sharon for all the work and the work of partners in pulling this plan together, because it's an excellent plan, and I think it gives a framework to manage the future as we go forward. I would be supportive of Sharon's recommendation around pulling together an expert group, but my one area of concern is just being clear about where decisions lie and who makes decisions and how quickly we might need to make a decision if we were to very rapidly see increased transmission across York. So what we wouldn't want necessarily there is pulling 3 different groups together to form a view that may well complicate our ability to make a quick and decisive view. So I think absolutely, Sharon, let's have a COVID-19 expert group as you suggest, and indeed many other areas have got those in place. But just be really clear in the plan what their contribution would be if we were to see a rapid increase in transmission across York, because I think we'd find that we'd need to be calling together the outbreak advisory board very quickly and making a decision quite quickly in those circumstances. So just not to confuse the governance of the decision making.
I'm going to bring Sharon Holden, the corporate director, in for the last comment, and then I'm going to conclude this item. Sharon?
Thank you, Chair. Picking up on what Simon has just said, and I guess it's just an observation, as one of the things that we all commented on throughout the management of the emergency element of the pandemic across the system was the way in which we all as a system and partners came together, and some of the decision making that was done at speed. With some great pace to it, and people describe it like a cutting out of all the unnecessary stuff around our decision making. We actually did things. So my only cautionary note about another board or another group of people would be that it feels a little bit like the way we used to do things. If we're not quite sure about what to do, set up another group to talk about it. And I would just want to be really sure that there was a very specific and helpful purpose to that group. The way Sharon describes it, I think there probably is, but I think we should always keep in the back of our minds at the moment that we made some strides by default throughout the pandemic management, and we don't want to lose those.
I'd like a conversation to go on outside the board and some comments to come back to the next meeting. But I think the whole point about having to make decisions at speed, but also bringing together all the evidence so that those decisions can be made quickly, is quite important. So I think that there is work to be done on that. So in conclusion on this item, if you have the papers, paragraph 22, we are asked to be committed to the plan as you have heard it explained to you, and to take that commitment back to the organisations we represent. And you've heard quite regularly, and will still go on hearing, I think, about the importance of communication and get the right messages out as quickly as possible. This time I'm going to ask people to raise their actual hand so that those that are watching can see that we are committed to what we have just been talking about. Please. Right, thank you very much, everybody. Now I'm going on to agenda item 5, which Peter Roderick, the consultant in public health, is going to give a presentation about a very interesting assessment he's done on the impacts of COVID-19. Peter.
Thanks very much, Chair, and hello everyone. I'm going to share my screen. Can everybody see that?
Yes, thank you.
Excellent, thank you. So I'm here to talk about the Rapid Health Needs Assessment that was written and published at the beginning of June. It was done quite at speed with a recognition that in the days in which the pandemic, we were still seeing quite a lot of cases coming through. There was also a desire to think about what the world would look like once those case numbers have come down, and to rebuild, to recover, to reset, various versions of that sort of terminology, and to do so based on a good understanding of how COVID had impacted York and surrounding areas, wider than simply those who had become ill from the disease, but the wider societal implications, and to build such an assessment on a standard approach using a health needs assessment approach, which is regularly used and done at pace in a sort of way that is akin to a health needs assessment following a disaster is often done around the world globally. And what we did was to do it on a North Yorkshire and York footprint and to feed into some of the regional leadership groups that were established. But what I'm presenting today is mainly York specific data. Tried to make it as York specific as we can. There may still be some bits and pieces in here which refer both to North Yorkshire and York in the original assessment. The full assessment is available online on the York JSNA website, and today I won't be able to cover in any great detail everything that assessment says. There's a lot of words in it, but I will try to pull out some of the main points for partners around the table to hopefully kick off our discussions on it. We did some data analysis, gathered lots of intelligence from partners in the system for the assessment, and also did a public survey across Vale of York CCG area, which had about 600 responses, which really went to inform the needs assessment as it was. And hopefully that should be clear on that second slide, which summarises all I've said so far. This third slide gives a sense of how we conducted the assessment and the model that we used. Thinking about the pandemic across 4 waves that I guess have landed on society and are still with us. So thinking about the direct wave, the way in which direct infections from COVID-19 have caused harm and need emerging in our community, and still do, and still might if we see an uptick in the number of cases in the future. Thinking about the immediate wave, that lighter bluer line you can see. So really thinking about the ways in which society and life changed so rapidly, healthcare changed so rapidly, and that there were needs which would have emerged from those changes which affected people's health. And then thinking about the grey line, the chronic needs, this might be illustrated by long-term conditions which maybe weren't managed in the best way across the course of the pandemic, and we find the impact on people's long-term general health may suffer. And then the fourth wave, the red wave, possibly the biggest one when we zoom out and write the history books, around the way in which the pandemic has left an emotional, a mental and an economic scarring, I guess, on our communities, and thinking about those 4 waves. To think about the first wave, the direct impacts of COVID-19, we thought about in each category who were the most vulnerable at the outset of COVID-19, aware that we didn't come into this in a neutral place, but there were people who were more vulnerable from the start. And for each of those we've listed the groups that we considered were the most at risk in each wave. And then we've summarized the impacts to pick out a few things for this first slide. Tragically, we've seen over 160 deaths in York from COVID-19. 43% of those were care home residents. We've seen mortality from other causes, which is potentially, and there are cautions on some of these bits of data, and it's hard to draw absolute conclusions, but potentially linked to the pandemic if it is such that examples such as suicides, which may potentially have been linked to mental health issues caused by lockdown, or timely urgent care not always being as available, or people not seeking it in such a timely manner, and seeing some upticks in some deaths from myocardial infarction, heart attack and stroke that might be due to that. And then thinking about the direct infection and over 3,000 people across North Yorkshire and York hospitalised, and then the discharge needs and the aftercare needs, what people are often calling long COVID, that COVID doesn't just go away immediately, that there often are months and months of difficulty following. And then we listed for each section possible mitigations and key gaps, which partners can read in the report. This next slide, I'll just pause for maybe 5 or so seconds on each of these slides, summarising what partners told us and what the public told us in response to each of these waves. And my reflection on each of, when we were going through what the public were saying in particular, was quite a large amount of distress, difficulty, uncertainty, worry and anxiety that people answered the survey expressed. And that needs to be borne in mind. We've tried to intersperse the needs assessment with the views of the public all the way through, and there's a wider document available which summarises everything that the public told us within that. Thinking about the immediate impacts, again, listing who's the most vulnerable at the top there, and picking out a few things from the list that we really were emphasised when we would talk to people and we looked at the data. Thinking about areas of healthcare which saw real reductions in the amount of people that were accessing it. So general practice, dental, healthcare, attendance at A&E, people who are on an inpatient ward with mental health problems, and safeguarding, all saw quite large reductions in the number of people accessing care, and some of that will have had implications for their immediate health. And then some possible mitigations and gaps again, which have been listed at the bottom there. And this is what partners and what the public said on that point. And again, just leave 5 seconds to read that. Thinking of the chronic impacts of COVID, so the things that were emerging and maybe an existing long-term condition or an existing health problem or existing societal problem that was exacerbated. To pick out a few things here, within healthcare, a lot of reductions in referrals across the board. If we're talking about referrals with a suspected diagnosis of cancer, if we're talking about elective attendance and elective operations, if we're talking about improving access to psychological therapies, IAPT within mental health, the first line of support for people with depression and anxiety. We saw drops in a lot of those areas and quite a lot of others as well. Our social prescribing services and our voluntary sector raised a number of chronic impacts that they were identifying: bereavement support, mental health in relation to isolation, anxiety, the support that wasn't always as available as before for carers and for people with learning disabilities. And I'd also highlight here, it's not on the slide, but it does very much get into the presentation around children and young people, their mental health in particular, particular school years in which that was felt most acutely, whether it be year 6, year 11 and 13, those key transitional years, and the mental health implications of uncertainty, anxiety at particular key moments in life, and seeing our children and adolescent mental health services stepping up to that through a massive increase in remote consultation and support, but still seeing lower numbers through those services, and aware that some of the harm and the need may be stored up for later points. Again, I'll put up this slide for just 5 seconds, what partners and public told us about the chronic impacts of COVID-19. And moving on to the long-term impacts, of which there are so many, and it's difficult to pick out the key ones. Thinking about negative impacts of health behaviours and lifestyle choices, which may have hit harder. A classic that has been noted in many places would be smoking, and smoking in the home, and the risk of secondhand smoke when people are obviously locked down or isolated. Thinking about people's alcohol purchasing habits, which have increased, trends within substance misuse. There are some risks that we've identified and some intelligence and insight that we've got from policing partners around how the impact of COVID has been on their services, around homelessness, bearing in mind that every single recession that we can recall has seen a rise in homelessness in the last century. So there are worries there around housing issues, certainly into the long term. And then some positives, and there are some positives, one of which being air quality, which improved quite markedly in the city during COVID. And then, of course, we couldn't neglect to talk about the economic aspects and some aspects in the report that were an early indication around universal credit uptake and around the large proportion of the population who were furloughed at any one point, and obviously the job insecurity arising from that and the health need that we may see in the long term. And again, some possible mitigations and key gaps at the bottom noted. And then on this next slide, what partners have told us, what the public said. And so finally, we concluded that there was impacts on mortality, on morbidity. There were impacts that were around the unintended consequences of the system response to COVID, what we did in healthcare, what we did in other parts of the system within the council, within the voluntary sector, or what we were forced to do, I guess you might say, by the restrictions that we had to take into account, and how that might have affected prevention opportunities or healthcare avoiding patient response. And there were unintended consequences of some of the wider policy, particularly the lockdown policy and the economic, mental health, educational impacts of that. And it's important to say it was a very rapid assessment that we collected data in short order to try and inform recovery for the system and to inform the plans that were coming on stream. So we weren't able to cover everything, and there are probably a million other impacts that we could start to think about and quantify, and we'll go on to work on in the months to come. The recommendations that we made were 4 areas in which we found that the need was really high, and we really wanted partners to take into account as they were thinking about recovering and resetting. You're thinking about infection minimization, and we've talked about the outbreak control plan this morning, thinking about mental health, thinking about access to healthcare, and then thinking about prevention of long-term conditions and building a healthier society. And then additionally noting some other recommendations around health and digital literacy and not seeing people left behind by the rapid shift to digital delivery of services, thinking about taking a population-led rather than a demand-led approach to recovery, thinking about that wider approach to vulnerability that isn't simply just dividing the population into shielded, vulnerable and everybody else, but thinking about the different nuances within that categorization and how we'd work in different ways potentially if and when a rise in cases comes. And then a commitment to keep on basing the work that we do on need to do further work around health needs assessment, covering in the next phase second wave readiness, how ready we are as populations, and thinking particularly about community services in the NHS and social care as sectors. And then the final slide there, 2 messages, a message of hope and a message to galvanise, which came from our partners as we were conducting this piece of work. And I'll close there, Chair, and pass over to you for comments.
Thank you, Peter. Peter, can those slides be circulated after the meeting in case people haven't had a chance to read them?
Most certainly, yes.
Do that? Yes. Okay, thank you. Right, any questions or comments for Peter, please, from anybody? No blue hands. Andrew or Nigel, would either of you like to comment on what you've just heard? Dr. Andrew Lee or Dr. Nigel Wells?
Yes, Chair. I'm Nigel Wells, Vice Chair of the Health and Wellbeing Board and also Clinical Chair of the Vale of York CCG. I think it's a great piece of work, this, Peter, and as you know, it's been praised quite widely regionally. So I just wanted to say thank you for all your work. I think what comes through for me in this was the public messages there and how this really affects our residents and how it brings to life the real issues that we are now facing. In my practice, I know that we are having increasing mental health presentations, and it is quite stark, the rise that we are seeing. And also just a reflection is we are seeing late presentations of illnesses that we wouldn't have seen for many, many years. So there is going to be an increased pressure on health services. But I sort of finished on the comment of the last slides, which is to get to population need and residents need, and we go for that, not in a demand way. And I think we need to keep that in the forefront of our minds as we go forward, because we're always challenged on numbers in waiting lists or in demand lists. We need to get to need. And so I think that's really, really important, and it could be a bit of a time for a refresh and a reset around that. Those are my comments, Chair. I hope those are helpful.
Thank you. I've got 3 people indicating now. Firstly, Councillor Ian Cuthbertson.
Thank you, Chair. I thought Peter's presentation was fascinating, and my only observation is that it would have been really useful to have seen it before the meeting, because there's so much there, and it was such a different form of helicopter view from what we've had of the pandemic from a purely public health perspective. So I think that would be really helpful to circulate that. Secondly, the point about that Nigel's just made about the presentation of late presentation of illnesses that we haven't seen for a long time. Does that just mean a late presentation such as you haven't seen, or are we suggesting there are some new illnesses? Thirdly, mental health. My wife and I have both been discussing the effects on our own mental health, and it's obviously going to be very difficult for young people, but I do think there's a tie-up between this situation and the level of usage of A&E, which seems somehow to decline when there's a national emergency, because people think that their condition isn't important enough. And I do think that maybe there's an opportunity here for getting people to view their situation in different terms in relation to the overall medical situation, so that somebody who really is ill, if late presentation is the problem, actually do present at the appropriate time. Thank you.
Peter, I'm going to take all 3 speakers and then I'm going to ask you to respond. Councillor Perrott next, please.
Thank you, Chair. I think for me, the thing that came out really clearly is how much capacity we sort of need to sort of maintain in the system, potentially, just because we saw, as others have touched on, people not presenting to the NHS. I don't know whether that was a conscious choice because they didn't want to overwhelm a service that they felt was going to be under huge pressure. But it is, obviously it's a worry, isn't it, that there is going to be this surge of people coming forward, whether it's making disclosures about any sort of abuse in relationships right through to late diagnosis. So a challenge to everyone sort of sitting around the table, really, how do we sort of maintain capacity so that if people are coming forward, we can make sure that they receive really timely help now.
Thank you, Anna. And Sian Balsam.
Thank you, Chair. And I just realised I forgot to introduce myself last time. So I'm Sian Balsam. I'm the manager of Healthwatch York. Like everyone else, I was really interested in the presentation. I think it's a sort of a timely reminder of the things that we all need to keep our eyes open for. But I think some of the things that I particularly picked up on was it was really good to see carers identified. In so many of the stories that my colleagues who, some of my team were involved in the non-medical GP helpline alongside the social prescribing and NHS link worker staff. And so many of the stories were about the impact on carers who were supporting people in the absence of their usual support mechanisms. So I think it's really, really good to have seen that theme coming through strongly. I think there are 2 different challenges that we face, and these were summed up for me in one email I received from somebody around they personally have some routine appointments around monitoring a potential skin issue, and they are currently too anxious to seek their usual routine care for that. but they are really worried about another member of their household who needs an operation for something that isn't a life-saving operation, but is something that could have a long-term impact on their mobility, their confidence, and their ability to live their life the way they would choose to. And within that household, you have exactly the two kind of main challenges we're facing: those people who are not accessing routine care through fear, and those people who can't access routine care because it currently isn't available. And I think there is something for me about the messaging we put out there about public confidence. I think everybody has been grateful for what our NHS, our care home providers, our voluntary and community sector have been doing for people. But there is starting to be a sense of, and what's going to happen now? And when you've got the media messages around things coming back to normal against a backdrop of, we know this isn't normal yet, and we might be some way from normal, how do we start putting out messages that enable the public to be confident that we are going to start addressing some of these longer term impacts in a way that is fair, that actually meets the needs that people have, rather than that responds to those of us who are best at shouting out and getting the response we want? I think if we are not careful, we will reinforce inequality. So I think it's really kind of important to consider what we do to minimise the gulf in health inequalities during this recovery period.
Thank you. I got Dr. Andrew Lee, and then I'll ask Peter to comment on any of those speakers, and then I shall conclude the item. Andrew?
Thank you, Chair. So firstly, thanks, Peter, for your hard work on this health needs assessment. For those of the board who aren't aware, it's actually been used not just in York, but across other local authorities in the Humber Coast and Vale regions. So it's really been an insightful piece of work. Completely agree with Sian about the needs and the welfare of carers in particular, as well as those who do not have a voice or who tend not to be heard. So when we carried out this health needs assessment, especially the public consultation bit, public survey bit, we were keen to hear those voices. And they remain, in my mind, a need group really going forward. Two things I want to flag to the group. Firstly, it's around how do we get some realistic sense of expectations of services from members of the public. I see Simon's there, and Simon, you and I have the same problem in the sense that it is nigh on impossible to get back to pre-COVID levels anytime soon. We're working hard, but it's difficult. And just to give you an example in primary care, previously to take a blood test, it might take us 6-7 minutes to do. Now it's taking us 10 minutes. And you might think, well, it's only 2.5 minutes more. But that is the equivalent of a 33% reduction in overall capacity. Yeah, and that's because our staff need time to put on personal protective equipment and so forth. But we're seeing this right across all our services in primary care. When you factor in how things have to be done differently. And I'm sure, Simon, you'll have a view of this as well in secondary care. So how do we get a sense of realistic expectations from members of the public that the appointments might not be as timely, that they might have to wait longer for certain non-urgent procedures? But it doesn't mean that we are not mindful of the ill health or morbidity they may have. It's just that the health service is having to prioritize more life-threatening conditions. And it does mean that some folk with minor ailments might have to consider other means of self-care or healthcare, be it from their local pharmacist, for example, and not necessarily pitching up at an emergency department, expecting the emergency department to sort out a minor ailment. So there's that very difficult and complicated conversation to have, because at the same time, we don't want to put off people who have got genuine needs, who really need to come in because they might be carrying a cancer that has yet been undetected or undiagnosed. So that's the first really difficult problem we've got in the health service. And the second one, as I said earlier, I'm worried about the winter. And one thing we can all do to reduce risks for the entire system is getting flu jabs, getting our flu coverage as high as possible to reduce the potential burden and the potential vulnerability in the system. And that's something that many of our lead staff are working on at this point in time. And it's not just a health thing. I would say it's wider than that. It'll extend across the social care, because if people are off ill, if staff are off ill, it will affect the ability of services to function. I'll leave it at that. Thank you, Chair.
Thank you. David Harborne wants to make a quick comment, and then I really will go back to Peter. David.
Thank you, Chair. Yeah, 2 quick points, if I may. One is the emphasis on the wraparound support. So, for example, in terms of discharge and aftercare needs of people who are discharged from hospital or who are recovering from, whether it's COVID or another condition. Also, the needs may well be practical and social as well as medical. Who's going to cut the grass? You know, those sorts of things. So it's the ripple effects, as I mentioned in an earlier part of the meeting. But my other and I think very important point, reflecting back on the fact that we started the meeting with a minute's silence, quite rightly so, I would just like to ask if anyone would comment on how we make sure we look after the mental and physical health of the people who are working in the NHS, in residential care and in domiciliary care, because we know that COVID has had a disproportionate impact on those parts of our workforce and our community. And I just want to make sure that we have systems in place that we're really going to look after them as we move forward. Thank you, Chair.
Yeah, that's a terribly important point. Okay, Peter, any concluding comments from you?
Yeah, well, thank everyone for comments, and it's a fascinating discussion and incredibly important stuff. I guess all I would say is, you know, I came into public health as a field, and one of the things that motivated me was the making of the invisible visible, and actually showing and highlighting need and vulnerability, and I'd like that conversation to continue, particularly around some of the groups that have been identified. We did specifically go to carers, to those with visual impairment, and those with learning disability, to try and to get their views into work like this, so it will drive change. And then finally, just thinking about where we were before COVID as well. In reality, there were certain groups in York who already had much worse health outcomes before we even started this. The ones I've listed: people with learning disabilities, people with severe mental illness, but people who live in the bottom 10% from an income perspective. And you know, I think we have nearly 10,000 people in York who are in the bottom 20% nationally. They already had poorer health outcomes, but also had what we often talk about, the inverse care law. They received less health care in general. They maybe didn't seek it as quickly. And I think it is about prioritization, and it will be about some hard decisions about some of the messages that we send out, that actually inappropriate access of healthcare has a knock-on effect for those who would be using that clinician's time. And so having I guess a grown-up conversation about that, and thinking about that as a city, about how we can prioritise those who needed it most before the pandemic, and definitely do now, and how we can all pull together and access healthcare appropriately, prioritise and assign our resources appropriately, so we meet the most need and have the best health outcome, not merely keep the services that we used to have going and restore them. We're going to need to make some changes to do so. So that's all. Thanks, Chair.
Lovely. Thank you very much, Peter. It's a really fascinating presentation, and I know people will reread it when it comes round. Right, I want to go on to the next item, and I want to just point out that this links with the second item 7 that follows, because what I'm going to ask now is what we've learned, what we think is really useful that has come out of this, and then we're going to discuss what our next steps are. And I'm going to go around, and I'm going to start with Amanda, and then Gillian, and then Phil, just so you know. So Amanda, I'm sure you've got the presence of mind to tell us what really positive things have come out of the pandemic?
Chair,
Any
Amanda
response?
has
Yeah.
temporarily left the room, but would you like to come back to Amanda when she's back?
Oh, I would. Sorry. Yes. Okay. Is Gillian there?
Yes, I am.
Oh, Gillian. Thank you.
So I think in terms of the real positives has been how systems have pulled together. As you'll be aware, my role is actually now across the whole of northeastern Yorkshire, and so actually not just within the York system, but systems generally across the patch have really pulled together, worked immensely hard to rapidly implement changes. I think there's been benefits in terms of the use of technology. However, I'm very mindful of those where use of technology is either not possible, not accessible. So we just need to be mindful of those inequalities. But yeah, I think it's that pulling together and working as a team.
Lovely. Thank you very much, Gillian. Phil, would you like to make a comment?
Yes, thank you, Chair. So I think in terms of the pulling together, I think, yeah, absolutely concur with Gillian there. The way that the Local Resilience Forum and the groups have come together both across the City of York and the county, I think has been an exemplar across nationally, actually, as to how those groups are pulled together. And again, certainly commented on when our military colleagues came to support that working, that actually they found a very cohesive, well-organised partnership there working for all of our communities with the single aim of keeping the community safe. So I think that was absolutely commendable. I think the other element, again, in support of our NHS, at the start of this, when we felt that the Nightingale Hospital would have been filled, and the way that that was brought together in Harrogate was extremely professional, extremely well done by the group as well. And I think the sign of success from the first element was actually that we didn't have to use that at all. You know, I think the way it was brought together was fantastic. The fact that the NHS and our partners pulled together and didn't have to use that facility, I think was very, very positive in terms of that. The other thing I would like to do is obviously say a huge thank you as well to all of our communities, because actually the other reason why I think that the NHS Nightingale Hospital hasn't had to be used in the way that we thought it would, and that, you know, talking about 500 beds there of full occupancy not being used, was because the community reacted so positively in North Yorkshire. And again, policing wise, yes, we've issued a significant number of tickets, but the vast majority of those were visitors into the county. So to me, it's a huge thank you to the communities for actually adhering to the legislation and the guidelines in relation to that. So that's just a quick update from myself.
Lovely. Thank you very much, Phil. Simon at the hospital.
Sorry, just unmuted myself. Yeah, but probably three areas really, and probably reflect the comments that have already been made. The first point to make that I think has been a real positive has been the outpouring of public support and goodwill for the National Health Service, and I think that's had a really positive impact on staff across the board, whether they're working in hospitals, primary care, opticians, dentists. I think it's been really well received and has kept people going through what has been a very difficult and challenging and traumatic time for many staff. So I think without that support, it probably we wouldn't have got through it as effectively as we have as a system. The second point to make, and this is an NHS point. I think the NHS was already moving away from a world of competition and commissioners and providers, and what this pandemic has accelerated is that sort of sense of collaboration between NHS organisations and primary and secondary care, and between hospitals, thinking about how we use our clinical teams, how we use our capacity and our estate more creatively and more effectively. And I hope that will, well, I know that will continue going forwards. But what we've seen is a sort of little boost, really, a booster rocket that has accelerated some of those conversations. And the third point is the work between partners. We've been able to do things in the last 12 weeks that the people like me and people like Sharon have been talking about for many years. And because of that speed of decision making and that commitment and willingness to make changes, we've put in place a range of measures and changes that I would have thought we would have still been working on for the next three or 4 years. So the work we've done around how we effectively manage discharge processes and flow through the hospital has been revolutionary, really. And yes, it's been helped by the government's commitment to resource packages of care, but I absolutely know that there's a commitment in the system for us to think of ways in which we can sustain those measures going forwards. So the general message has been about effective working between all partners and sectors, and that outflow of public support for the service.
Lovely. Thank you very much, Simon. Mike Padgham.
Yes, thank you, Chair. Just briefly then, I think I'd echo what a lot of other people have said. I think working together in partnership, critical, has been good. Technology as well. And also lessons learned for the future, because as we know, this virus isn't going anywhere, to get us better prepared for the second wave, really. But again, you probably would expect me to say this. I think a positive issue has been to highlight the fact that social care reforms might come sooner than they would have done. And in fact, social care needs to be held in the same regard as the NHS. And I think gradually politicians have woken up to that. And I think that's a positive way forward.
Lovely. Thank you very much. Yes, I would expect you to say that. David Harborne.
Thank you. Yes, well, you'll expect me to say the next bit. The voluntary sector responded remarkably quickly to the challenges presented, and there are so many organisations that ought to be thanked that it's almost invidious to single them out. But clearly, at a time when we're concerned about issues such as domestic abuse, then the independent domestic abuse services Survive come to mind. On the mental health challenges, York Mind, Samaritans, of course. Yes. We must never forget the important role that they play. NSPCC, there's the people involved voluntarily with food banks. We've spoken about carers, and I used to be a trustee of a carers centre elsewhere in Yorkshire, and so I'm full of admiration for the work that York Carers Centre does. The other side that you won't be surprised about is, of course, at the same time that there was an urgent need for the voluntary sector to step up and to work in close collaboration with our statutory sector colleagues and friends, we've also suffered financially, and those charities which rely on fundraising weren't able to go ahead with events. Yeah. Charity shops have been closed, other commercial activities haven't been feasible. And one of the issues for York CVS, through the contacts that we have, is our concern that some of the organisations that have provided the most help are actually now the most vulnerable. And we as that very quickly. We've appreciated the additional help that the government provided to frontline services for safeguarding and for the help for St Leonard's Hospice, for example, 100%. And the big lottery has stepped up. Riding's Community Foundation has been fantastic. Yeah. There is a lot more still to be done, though, but I really want to stress the positive. It's been fantastic the way people have stepped up. And the last point to make, 4,000 people volunteered spontaneously,
Yes.
who, whether they've volunteered in the past or not, I think that sets us in tremendously good stead when we look to the future. If we could just bottle that willingness to help,
Yes.
that really would help us move forward.
Thank you. Sharon Holden.
I think I'd like to focus on, in my comment on when we're all talking about the things that we did really well and quickly, and there's a reason for that. You know, it didn't just happen, and we have to make sure we're the only ones who can take responsibility for making that continue. And for me, that comes down to, in terms of as a system, we're all in one system, but we're all in separate organizations, and it comes down to a need for courage and bravery across the organizations. And there will be times when we have all got to put aside our organizational agendas and personal priorities. Now we talk about that a lot, and I know I talk about that a lot, but probably the pandemic experience is our first experience as a system of actually seeing that happen. So I would invite us all, the next time a decision is being made, which isn't necessarily going to be the best decision for your own organization or your own role, let's all have the courage to make that decision if it's the right thing to do. And the other thing I would say about that is really not easy, and we know that. So I think we're going into the not easy territory, and I hope that we're all going to be in that together. That's what I'm really looking forward to.
Thank you. Councillor Cuthbertson.
Thank you, Chair. From my own perspective, the big positive that's come out of this for me has been the willingness of our schools and public health teams and volunteers and support teams in schools to reach out as best they can, given the degree of separation to the children and families, if you like, in their care. That's perhaps an over strong use of the word care, but it is a significant thing. I think what is negative for me has been the fact that we haven't taken advantage of the possibilities of remote working to the extent that we could have. And I hope that the Department for Education will think more seriously about altering the school day and flexibility in the school day to cater for something like this, because Peter mentioned rigid systems of delivery from the past, and in fact the education system is quite rigid in terms of its delivery. But otherwise, I mean, I'm amazed at the contribution made by volunteers, by public services across the spectrum. And it's reassured me that actually the Britain I knew as a child and as a young person after the Second World War is actually capable of bringing itself back into existence again. Don't want to be too self-congratulatory, but, you know, I think that sums it up quite fairly. Thank you, Chair.
Thank you. Dr. Andrew Lee.
Thank you, Chair. I think my one reflection about what's gone well is a real sense of community spirit that has emerged. And I'm not talking about just community in the singular. In York, we have a community of communities, I guess. Even those of us on the call here, we are a community in that regard. And it is not by accident that we have had a low rate of infection.
No, that's right.
Yeah, I think many members of the public out there who are listening in and beyond, who have supported and been compliant with the advice to socially distance, to hand wash, and so forth, they've made the difference. And exactly as David's mentioned, the 4,000 volunteers have put themselves forward. And I'm mindful that not all of them would have been placed, but the fact that they've been willing, that's amazing. And going forward, they have been patient with us in the statutory services and health and social care, and certainly for primary care. And really the ask and the hope is for the public's continued support and patience, really, as we try and get through this. And clearly we need to do this together.
Yeah.
Thank you, Chair.
Thank you. Councillor Anna Perrott.
Thank you, Chair. I think for me, it's mostly about how people have really stepped up, you know, whether you're providing a service or whether you've been receiving one. I think people have really gone over and above what anybody could have reasonably expected, and they've done so really quickly. I think everybody's had to adapt quite, you know, rapidly to new ways of working, and whether or not that's you know, sort of on a personal level, sitting at home rather than in an office and having to sort of deal with all the complexities that's thrown up in your own life. But also just for people stepping up and getting out there and volunteering and knocking on doors of neighbours who are elderly and offering to do things. I think we've really seen the best of what we can all do when we start looking out for each other, and it's something that I do hope we can continue within our communities.
Good. Dr. Nigel Wells.
Thank you, Chair. Just to echo Simon's point around the public valuing the NHS staff, and how thankful I am for the public doing that, and how that's been shown. And the other thing, really picking up on Sharon Holden's point about doing the right thing, I think that's absolutely right. Going forward from now on, it's about how we all link together as communities, as Andrew said, to do the right thing, and that's what I would really want us to be focusing on now.
Lovely, thank you. Naomi Lonergan from TUV, would you like to make a comment?
Hi, yes, thank you, Chair. I think what's gone well, again, echoing a lot of what other people have said, we've shown that where the system is focused on the shared objectives and goals of what we can actually do, possibly do. I think the agility that organisations have shown, we've broken down barriers, we've brought forward service developments, that we've, you know, the way that staff have adapted, and the public, to the use of digital ways of working as well through health and social, whilst challenging and not universal by any means. I think there are huge, you know, we've had plans around that for a long time, and that's been brought forward and being used successfully in some areas. So huge thanks to the public and communities. I think certainly from our perspective in the Trust, the staff who have planned to retire or have retired and returned to us to help us through difficult times, volunteers, staff have adapted and changed what they're doing to meet new needs. So we set up a 24/7 helpline within days.
Yes.
We opened a hospital in the middle of this. So I think it's huge thanks to the skills and knowledge of the staff, and also local businesses, schools, supermarkets, you know, have all risen to the challenge. And I think it gives us a real opportunity to build, you know, we've talked about strength-based communities for a long time, and I think we've had some really excellent examples of that we need to build on.
Thank you, Naomi, and thank you for your briefings which come round. They're very, very interesting and useful. Sian. Sian Balsam with us?
Yes, sorry.
Oh, good, right.
I think, like many people have said, it's really important to acknowledge how well our communities have responded, whether it's neighbours picking up milk for people, checking in just to see how people are doing. I think that real sort of swelling of neighbourliness and wanting to know that the people living sort of very close to you are doing okay, have everything they need. I think, again, I would like to echo many of David's sentiments around the voluntary sector, that lots of the individuals we were speaking to who had needs to be met in some way, shape or form were connected with voluntary and community organisations who could help them, enabling our statutory services to focus on those who needed their sort of support. I think for me, I think I recognise some of Councillor Cuthbertson's comments around schools. I think there were lots of schools who did some really good things, but I think some of the negatives for me would be around consistency of support and people knowing what would be available to them. And I think schools have had a really tough time of it, but I do think there wasn't a consistent approach across our schools to providing support for our children and understanding what they could be offering in a more digital, more virtual world, whilst acknowledging that there would be additional things we'd need to do to make sure that children at risk of digital exclusion were able to be part of those plans. And I also think it's been great seeing all of the partner agencies pulling together with that shared vision. It would be wonderful if some of that fleetness of foot and willingness to do things differently can stay part of our new normal, whatever that looks like. And I guess also to say thank you to the people who are responsible for commissioning services, for being willing to accept that you weren't going to get the service that you'd paid for because that service couldn't be provided. But actually the service that you needed to provide was much more useful at that time. So I think not being tied up by paperwork and contracts and being happy to do what was necessary was really, really useful. And we should maybe try and remember that when we're going forward, that doing the right thing is better than doing the wrong thing, but that ticks the right boxes.
Thank you, Sharon. Now, I should just have Amanda and Sharon Stoltz left, so I'll go to Amanda first if she's with us now.
Thanks, Chair. Yeah, I think echoing lots of what a number of people have said, I think particularly what stands out as the most positive thing has been just fantastic partnership working across all agencies. And as a number of people have said, a real willingness to work differently, work above and beyond, and to do things at speed and at risk because it was the right thing to do. So I think really notable in that was the establishment of the community hubs. You know, they happened very quickly. Yeah. People were very willing to go and work in roles that was not their typical day-to-day job, and provided support to, you know, some of the most vulnerable people in the community in terms of food, medical support, but also that kind of emotional support. You know, members of staff that went out and did shopping for people who'd got particular health needs, excuse me, or particularly dietary needs. So, you know, they've been really important and valuable, and have been a combination of, you know, existing community groups, voluntary groups, partners, staff, and City of York Council staff all working together. So I think they've been really, really positive. We've heard a lot today around social care. Let's not forget social care happens in children's services as well. And children's social care went to virtual working in 3 days, which is pretty remarkable. And the front door, the multi-agency safeguarding hub, has been operating virtually since then, and has improved its timeliness, has improved its way of working during a really, really difficult period. So, you know, many congratulations to all the staff that work in there, which are City of York staff, but also partner staff as well. One of the things that we will see and are seeing as a consequence of this is an increase in referrals into social care. One of the positives is that we have managed to support people to access support at an earlier stage. So our early help service has seen an increase in referrals of around about 46%, which is, again, thanks to communities and to other professionals who have been signposting families and supporting families to get that support early. We have now seen referrals at the multi-agency safeguarding hub back to pre-COVID levels, but they're not above that. If we hadn't have seen that significant increase to early help, it would have been, but we do have to plan for an increase in the future. I think the other aspect that's in that part of the world that's worked really well has been remote working. We are seeing much faster, much better decision making as a consequence of people working virtually. So, for example, if there is a concern around the safety of a child, we have a strategy discussion. Ordinarily, that would be a face-to-face meeting, which would involve people having to travel, etc. And clearly, some staff, for GPs, for example, aren't able to leave surgery to do that. So historically, have had low attendance. We are now seeing really good multi-agency attendance in those sorts of meetings. So those are things that we want to hang on to and keep as we go forward and come out of the other side of this, hopefully. And lastly, I just want to talk about schools. I have to disagree a little bit with what I think Sian was saying around inconsistency in schools, because I think York Schools and Academies Board has worked together in an astonishing way during this period. They normally meet once every 6 weeks. They've been meeting 3 times a week. They have taken a citywide approach to how they can work with children safely. have taken a citywide approach to undertaking risk assessment, sharing good practice, sharing resources across schools. And we've had no outbreaks in any of our schools. And we've also had one of the highest numbers of vulnerable children in our schools across the region. So, you know, I think we need to thank the school community for everything that they've been doing and all the work they're still doing, because they have a huge task to prepare for September. So whilst it might technically be school holidays, they are all still working on what they need to do so that most children can get back to school in September. And I think that really, my last point would be picking up what we heard in terms of the longer term impacts from Peter of this. And what we know is that the best thing we can do to safeguard a child, and the best thing we can do for a child's life chances, is to support them to be at school and be at school safely. So, you know, just to urge all of you to support the messaging that's going on over the summer and support the work that's going on over the summer around how we support children to safely return back to school, because the impact of not being in school on a child's life chances is significant. So we really do need to work on that together. Thanks.
Thank you very much, Amanda. Now I'm going to Sharon, and Sharon, we're going to go seamlessly into the next item. If you want to make, this is Sharon Stoltz, any final comments and then go into what the next steps are, I'd be very grateful. Thank you.
Okay, thank you, Chair. I mean, I would agree with everything that everyone has said. We often talk about public health being everyone's business. And I think sometimes we struggle to clearly articulate what we mean by that. But what I think we've seen over the last few months and what we've heard over the last, hour and a half is how York has demonstrated that public health is everybody's business.
Yes.
You know, at its core, public health is about keeping people safe. And I think we've demonstrated that very well. So I will probably end that bit just by saying that. In terms of seamlessly moving into the next agenda item, then the final agenda item, is having had all of the discussion that we've had this morning, you know, Peter's presentation, etc. What, as a board, do we now want to focus on? Maybe for the next 6 months, or longer term, if that's what people want to focus on. So we have a health and wellbeing board strategy, a joint health and wellbeing strategy. We refreshed that strategy earlier in the year in response to the Care Quality Commission whole system review, after which we decided that we needed to have a sharper and clearer focus on our health and wellbeing strategy. And I suppose if I can start off by maybe being a little bit controversial to generate discussion, is whether we now feel our health and wellbeing strategy is fit for purpose. We developed it pre-COVID, and now we're in the middle of COVID, and we're working into starting to think about restoration of services. We've heard that there has been a considerable impact on people's physical health and well-being. We've talked about some of the impacts of that, about health and social care, but also the wider determinants. Peter, in his presentation, suggested some recommendations that I think it would be helpful to just spend a minute looking at those. So in the recommendations, there were 4 areas particularly summarized. One was clearly we need to carry on with what we've been doing around minimising the spread of the virus and implementing our outbreak control plans. So that's a given. We have to continue to do that. Here, there's a highlight on mental health services and the approach that we need across our mental health provision to focus on the new disease prevalence patterns, what we're seeing and experiencing that has been shared from our staff and also from residents in terms of the impacts on their mental health. The other is around healthcare access. So we've talked about some of the really positive ways in which decisions have been made quickly to services. Someone made a comment that, you know, we've done in weeks what might have taken 2 years in our old way of working. So how can we hold on to that and capture that going forward? And then thinking about the long-term impacts, how we have a focus on prevention and population health management that will stand us in good stead going forward to try and mitigate against the worst impacts of the pandemic. And so my personal view is that, you know, these are the areas that as a health and wellbeing board, we have a responsibility to focus on. And that's not to say that other priorities we identified in our strategy aren't important. They are, and I'm sure a lot of that work will continue anyway through our mainstream services. But in terms of our responsibilities and our statutory duty as a board to protect and improve the health of our population, I would suggest that going back to Peter's needs assessment and the key messages from that would be the focus of the board going forward, would be my personal view.
Thanks, Sharon. I'd like people's views on 2 things, please. Firstly, what we should consider in our next formal webcast meeting. And secondly, if you would like to have an informal, unagendered workshop to discuss any particular points that we can then take forward to a formal meeting. Can I have anybody's views, please? I've got 2 hands, if I can just find them. Oh, Naomi.
Hi, thanks, Chair. I think obviously mental health is a key element and has been needs assessment, and obviously that was taken at a point in time. It was a really helpful presentation, Peter. I'm sorry, I just came in at the end of that. But since that point in time, we have seen drastic increases in levels of acuity and crisis presentations across the whole of North Yorkshire and York. I don't know whether it would be useful for the board, but as an organisation, we've been doing a lot of work around forecasting and what that may mean, and working as part of the system with that, obviously other colleagues and partners around how we will build this back to both pre-COVID levels and also the anticipated mental health surge. And I think what we know and recognise is that no one organisation will be able to respond to that. So how and where do we develop that? And also maybe to give an update, if it's helpful for the board, obviously we're currently engaging with Humber Coast and Vale colleagues around the development of the resilience hubs and the options appraisal that will be put forward, which will respond to the social care staff, care home workers and domiciliary staff that have already been mentioned in this meeting.
Yes.
So if that would be helpful, I'd be willing to bring some information to the next meeting.
That would be very, very interesting and very useful, I would say. And that could include quite a lot of our colleagues, volunteers, CCG, not just yourselves. I think that would be very useful. Sharon.
Yes, I wanted to take the opportunity to remind board members that the last formal meeting of the board that we had before this one was actually in the week before lockdown, I seem to recall, and we had a presentation at that meeting from Andrew and Sharon on population health and health prevention, a really well received, interesting presentation with a very vibrant discussion between all of us afterwards. And we were talking then about using that as the basis for shaping how the board would move forward and giving us some indicators about key issues that we wanted to focus on. I'd encourage us to go back to that now. And pick up that conversation and use that as a starting point for where we want to take this. It was really inspirational. I think we were all really fired up by the work we were going to do, and then the pandemic hit us. So I would like us to go back to that and pick up from there.
Yeah. Is that a workshop before it goes to the board, do you feel?
I think I'd be guided by Sharon and Andrew, really, as to how that would be. But it may well be, or it may be don't know how you feel about, Chair, having perhaps less agenda items on the board on some meetings, but more discussion around them,
yes.
Which I guess, is tantamount to a workshop, isn't it? But it's just a different way of focusing on an issue.
I think that's absolutely right. Andrew, would you like to have a comment on that one?
I share Sharon's view, and thank you very much for raising that, Sharon. I think it would be great if we could use and adopt a population health and prevention approach going forward across all sectors. The elephant in the room for all of us, unfortunately, is some really tight economic situations for all our organizations, whether it's the voluntary sector or the acute trust or primary care and so forth going forward. And we can either all think separately, or we could all try and continue the collaborative work together as a system, as we have been doing these past few months, to forge a way forward, really. So I think the aspirations set out in our health and well-being strategy are right. And the question is, how do we get there? And I would suggest that we examine how do we foster yet more collaboration between all the stakeholders here to achieve that.
Okay. Right, I'm going to have to close the meeting because several people have had to leave. I think we've got enough ideas to work on, but if there are any more ideas, if you'd like to email myself or Tracy Wallace, we can pull those all together and then come back to you. So I'd just like to say it's been a very interesting meeting and everybody has contributed, and I'm extremely grateful for that. And we will set up both a workshop and another formal meeting, and we'll notify that to everybody as soon as that's done. So thank you for coming, everybody, and thank you for your contributions this morning. They're very much appreciated. Thank you.
Thank you.
Thank you, Chair.